going into the new year, it seemed like we were still at a nadir of morale busting, burnout, and then, of course, this all happened.
The thing that happened that Dr. Eric Topol is referring to is, of course, the COVID-19 pandemic. Medicine in the Machine and Medscape are dedicated to bringing you up-to-date information and stories from the front lines of the outbreak.
This is different than anything we've dealt with before. And I think we need to approach it with humility and just say we need to be completely open-minded about what the needs are right now.
That was Dr. Tait Shanafelt. At times like this, Dr. Shanafelt thinks that leadership, particularly visible leadership, is of the utmost importance.
That begins with really listening to the healthcare professionals on the front line and asking them what they need, what their concerns are. That requires very visible leadership.
This is Medicine and the Machine, an information and conversational podcast about how technology is impacting medicine now and how it will in the future, hosted by Dr. Abraham Verghese and Dr. Eric Topol. In this episode, we welcome Dr. Tait Shanafelt. Dr. Shanafelt is the Chief Wellness Officer as well as Professor of Medicine at Stanford University in Northern California. Here now, please welcome Dr. Abraham Verghese.
Tait, it's such a great pleasure to have you with us, and I know you're incredibly busy at the hospital. You're in a unique position. You were someone who, in addition to being a hematologist, pioneered the whole concept of physician wellness through a series of wonderful studies and papers when you were at Mayo. And we were really privileged to hire you as the first chief wellness officer anywhere in the country, the physician wellness officer. And you have done some remarkable things with your WellMD program, but I don't know that you ever anticipated the need for the kind of wellness program that we're requiring right now. But before we get into that, I just want to ask you, as we ask everyone in this period of time, how are you coping personally? How is life? How are you managing to stay sane in the midst of all you're doing?
Great to be with you, Abraham. Thank you for asking that. And it's taken deliberate focus to make sure, despite the increased demands and challenges we're all trying to respond to so rapidly, to recognize that this isn't going to be a one-week sprint, and making sure that I'm taking care of my own health and wellness enough that I'll be able to help support our colleagues in the organization throughout this pandemic. I think for me personally, that in part really centers on making sure I'm getting enough sleep. I have to say, for the last several weeks, I was way behind, and I finally had a day off and both slept in and took a nap that afternoon. Try to replete the bank a little bit. Tried to make sure that when I get home each night, even though it's much later than typical, that I unplug for a half an hour or so and just check in with the kids and my wife. Has been important. I think some of the other things too that one of our colleagues in the psychology department shared on a webinar earlier this week that I really resonated for me was really titrating how much of the news I'm engaging with, whether it be television or even just in print. That I think there's just so much going on, and we're seeing it firsthand for ourselves each day at the hospital, that we don't need to, tie into that broader froth that sometimes we really just need to allow ourselves when we're not at work to just fully disconnect from what's going on with this pandemic so that we have some time to recharge. So those have been a few things that have helped me.
That's wonderful, and it's helpful for us to hear that from you. You began your wellness career, this invention of a whole new program in medicine, because of the burnout that is so prevalent in medical circles. And you really, did a lot to codify that and to bring about solutions. And then now you're suddenly faced with this very unfamiliar new kind of very real threat. Talk us through, if you would, how your thinking has evolved and how you've helped an institution cope with this and delineate sort of lines of action and response.
Right. I think, as you suggest, this is different than anything we've dealt with before. And rather than simply pull traditional tools out of our toolbox and try to apply them to this situation, I think we need to approach it with humility and just say, we need to be completely open-minded about what the needs are right now. And I think that begins with really listening to the healthcare professionals on the front line and asking them what they need, what their concerns are. That requires very visible leadership. We've been holding regular listening sessions over the last several weeks with nurses, physicians, advanced practice providers, residents, fellows, to really ask them, what is the circumstance now? What is worrying them most? What do they need that they don't have? What can leadership be doing? What information would be helpful for them? And I have to say, we've learned a great deal that has, I believe, helped us be a bit more effective in trying to have clarity in what supports we're standing up for our team members here at Stanford. But I think we need to acknowledge that things are so dynamic, and we need to be having these type of conversations, forums, channels for feedback with our colleagues regularly if we're going to continue to be effective in the way we support them. And I think it's just important, use fresh eyes right now.
This is Tait, Eric here, and I wanted to get your sense about this. So going into the new year, it seemed like we were still at a nadir of morale busting, burnout, and then, of course, this all happened. And I was reading an interesting piece by Lisa Rosenbaum in the New England Journal. It came out yesterday. And it gave me another thought about this. I'm curious to yours, but one of the many quotes from the folks in Seattle who were the first wave to confront patients in the crisis. This is from Douglas Leedy, the University of Washington medicine chief resident. He said, "A lot of us healthcare workers go into medicine for moments like this. And what is interesting is to see many accounts like this, just as there are the ones without protective equipment and all sorts of kind of nightmarish situations of the healthcare workforce being put into war without ammunition. There's also this coming together. Can you give us a sense of where all that is?"
Great observation, and I think we all are dealing with this, but our spirit is with our colleagues in New York City and Seattle at the front line. I did my training at the University of Washington, and every time I read about the reports from those hospitals, it just takes me vividly back to my residency days. And I couldn't agree more with the sentiment that this is part of our purpose as healthcare professionals, certainly as physicians, to confront disease, to confront fear, to support our communities, and to, even as we're trying to develop treatments and vaccines, to be with those who are facing this illness right now and the anxiety they experience, even when we're largely providing supportive measures for them. And I know I every day am dealing with a workload that's the most I've had in many years. Point the car toward work with a tremendous sense of purpose, knowing that everything that we do today is going to matter. And so I think that there is a strong sense of that. And yet I think you touched on this other dimension to it, that we also want to know that our organizations, our leaders are protecting us to the extent possible, providing the right supports so that even as we put ourselves potentially in harm's way, that we're not unduly risking our own health, particularly for our colleagues who have their own health conditions or are older and at higher risk of severe infection. But I think also a real strong concern of, I signed up for this to be a physician, but my children didn't, and wanting to make certain that we're not a portal of transmission to our family, and that our own dedication, altruism, commitment is not putting our family at risk personally, is I think a common concern. And I think it's, partly why there's so many dimensions to this challenge. I think right now, fundamentally, the core platform of well-being initiatives right now is about personal protective equipment. That is the fundamental well-being concern of today's healthcare professional. And, that's different than what we would have been talking about 3 months ago or a year ago. And so I think there is both that sense of this is why we became physicians, is to serve in times like this. But there's fear and there's anxiety and there's concern for both ourselves or our family as well.
Tait, I've been so impressed with, something that the dean said when we interviewed him on this program about the necessity for, clarity, open communication, and feedback. And you've done a marvelous job in the succession of videos that you sent out to make us aware of all the resources that are out there. You've also done a lot of feedback sessions with some of our frontline people, with all kinds of people. And I wonder if you would share with us, if you can, some of the lessons that are emerging from such conversations, some of the principles that are evolving out of that, perhaps, to the degree that you can.
Yeah, absolutely. I think maybe I'll start by saying that our team, our colleagues really need visible leadership right now from all of us who are either leaders just because we're more experienced colleagues who others look up to, or because we have formal leadership roles, or I would suggest that all of us as physicians really set the tone for the tenor of the care team. And so I think that first there is a real need for being willing to visit the wards, visit our teammates, ask them what they need. And that's sometimes, I know, frightening, because right now we often recognize we may not be able to provide everything that is asked for. But people understand that, and they appreciate that we're humbly asking for that feedback and trying to address what we can. Because again, I think they need to know that their concerns are heard and recognized is really a first step. I think this protection is a second step, and it is bigger than just personal protective equipment. People want to have very clear guidance of what can I do at the end of my shift to make sure that I don't take this home, this infection home. They need to know that they have access to testing if they develop symptoms. So there's that protection dimension. They want to know that we'll prepare them to be effective and provide good medical care if they have to be redeployed. And I think this is a dimension that we don't maybe fully always appreciate, but most physicians are willing to just step forward and help wherever is needed right now, even if it's far afield from their daily work area of expertise. But they take great pride in their work, and none of us wants to provide medical care that we feel is substandard because we have a knowledge deficit. And so I think that there's a real piece of our people asking us, when you deploy me where you need me, please make sure that you provide the right backup to experts, the right tutorials to help me come up to speed, because I need to know that I'm a good physician, even when I'm not in my area of expertise. It's been a sentiment that's been expressed. And then I think there's just the whole dimension around human limitations. And as we're working longer hours, rapid cycle shifts, a lot of exposure to human suffering, sort of limitations of resources that we've traditionally not dealt with in the U.S. healthcare delivery system and most Western healthcare delivery systems. Just the moral challenges, the ethical challenges we're dealing with, and providing support for just our tangible needs as we face that, be they basic needs such as food or occasionally lodging that's more convenient if we're going to be back in a short period of time or don't feel comfortable going home to our family. The psychological support, emotional support, so that we can continue to come back day after day. I think just some very tangible concerns or needs that people are asking of their organizations in this time. And then I think there's also a dimension that people need to know that if they do acquire the infection, that the organizations that we work for will take care of us and our family, and that although we're putting ourselves in harm's way, that we will be looked after should we acquire the infection. So I think those are some strong sentiments that have come through in these sessions as we've engaged our teams. And I guess the last one I'll just mention is that I think transparency of information is also really important. We're experts in the field of medicine. We understand data and numbers and what they mean. And I think to the extent we don't transparently share information, people tend to fear the worst. And so being, I think, transparent, authentic with our team members about where we stand as an organization, what we're dealing with, actually tends to alleviate fear and bring a sense of calm.
Stay with us. We'll be right back with Medicine and the Machine.
You can read the transcript from this podcast and find more Medicine and the Machine episodes at medscape.com/machine. Medscape news, features, clinical tools, and education are available for free. Stay on the pulse of medicine. Visit medscape.com.
Well, maybe just to take it to another level, the kind of antithesis of calm, and that's the issue of deciding who to put on a ventilator. This is becoming a big issue in New York City, of course, at the moment. And it is certainly possible, likely, that it will be similar in many other hotspots around the country. It's bringing kind of a whole new chapter in the biomedical ethics, because you've got these same people on the front lines who are making extraordinary decisions that otherwise, might have been done with a lot more time in academic centers, perhaps with the input of bioethicists. And now we're talking about a harrowing experience where you've got physicians who are in the trenches. They're sleepless or sleep deprived, and they're having to make some extraordinarily difficult choices. Can you discuss that?
You said it well, Eric, and I don't know that there's any simple answers. Obviously, just choices that we've never faced previously in the United States. And I think the only thing I would offer is that I think critical in this time that we don't feel that we have to make difficult decisions alone. There's just so many difficult choices right now. We tend to be a self-sufficient, self-reliant group as physicians. Traditionally, we're not always willing to ask for help, or that we have to be in extreme circumstances to be asking for help. And I think this is a time when we're all facing some of these particularly challenging decisions regularly each day, and we need to just have a low threshold to rely on colleagues. Don't have to feel that you're making any difficult decisions alone. The type of dilemmas that you're surfacing really are, horrendous. I think to the extent we do have some guidelines and approaches developed with the input of our ethicists and our ICU experts and many others, I think can help us feel that we at least have some guidelines by which we're making these decisions. Horrendous though they may be, that there's been a lot of thought and input from many voices in trying to think about how we approach them so that they don't, that they're not mercurial, and that we don't feel that someone else would make a different decision in the same circumstance. But at the end of the day, that doesn't make the choices any easier. And I think this is where, although in the first several weeks of this challenge, we've, we're leaned on the expertise of our infectious disease colleagues, our ICU colleagues, our emergency room colleagues, I think we're entering this chapter where the expertise of our psychiatrists and psychologists is going to become one of our most important resources in this time to both support our patients and communities, but also our healthcare workers who are having to make these types of choices, which are, really a Sophie's choice.
I really like your point about having multiple people, experts, whether it's in the ICU and other physicians, collective minds to help make these decisions to provide some level of comfort. But the other thing that's being developed right now, to bring it back to the medicine and machine theme, is now there's these algorithms that are starting to crop up to predict who you should put on a ventilator or not. That seems to be, to me, potentially a serious flaw, because those algorithms are not going to capture the human element. And this is something I get your comment. It could give somebody comfort also, because the algorithm says, yeah, I shouldn't intubate this person. But I can't imagine that that's going to substitute for judgment, human judgment.
That's well said, and I couldn't agree more. I think it's helpful for us to have some guidelines and principles that we're using to help us think clearly and in a consistent way. And so I would be a strong advocate for principled approaches and team-based decision-making for these type of choices. But completely agree with your sentiment also that this cannot be a cookbook. When we're making these incredibly difficult choices that are life and death choices, when a patient that we're caring for is at the other end of that decision, it just can't be an algorithm. And I think we have to have a principled approach and a group helping us make these decisions, so no one is making them on their own. But I agree, it shouldn't just be an algorithm.
And just to compound it, what we're talking about here is there could be 3 patients simultaneously that have gotten to the point of the question of intubation, and there's just one ventilator. And so it's not just a one-on-one decision. It's multiple patients, multiple families, multiple circumstances. This is already starting to happen. And then, of course, the even more strange, what I would have considered unheard of, the idea of, sharing ventilators between patients and that sort of thing. So, yeah, I mean, the way it's projected, we'll be seeing a lot of this, not just in New York City. So it's really good to get your thoughts. Thank you.
Yeah.
Tait, if I may ask you in our closing minutes, we are fortunate, both Eric and I, to work at large institutions with, relatively good support. But we've been hearing from a lot of our listeners and colleagues in, far-flung places, often very much alone with a small ICU. I wonder if you could give us two levels of advice for someone like that. One, as an institution, what might they do in the absence of a wellness officer and all the well-oiled machine that you have? And secondly, what are some simple recommendations you have for our listeners as individuals to, as you say, survive this marathon, because that's what it's going to be?
Yeah, absolutely. So I think for the institutions at large, I think not all institutions have unlimited resources to bring for support. But again, I think that leadership is our most important tool right now. And it's leaders being visible, being transparent, being honest, listening, asking questions, and doing what they can is the first piece. I think related to that is showing honor to our colleagues for the work that they are doing. The importance of that cannot be overstated. The people are making heroic sacrifices right now, and recognizing that, acknowledging it, and affirming it, even if we can't always meet all of the needs that we would like to meet, is critical. So I think those are two things that all organizations can be doing and should be doing. I think, again, to the greatest extent possible, providing protection and reassurance to people. And again, we can only do so much with respect to PPE, but there are other things of just being clear on what are the protections that people can, the steps they can take to make sure that they're not taking the virus home at the end of their shift, is something that all of our organizations can provide information on and guidance on, and I think can help reframe things from a sense of being powerless, of there's nothing we can do, to help us understand that that's actually not true. There are things that we can do to try to reduce risk to the extent we are able. Providing the moral and ethical, spiritual supports to people in these challenging times. Almost all of our hospitals no matter how large or small, have social workers, have chaplains, have mental health professionals that we can help draw on the wisdom and expertise of those leaders to provide support. So I think, identifying some of those resources that you do have, that you can mobilize to support people. I think for the individuals, touched on a few of these things earlier, but again, I think maybe a bit of a reframing of these are unprecedented times. We are facing great uncertainty. None of us will have all the answers. We need to rely on our colleagues, and we need to support one another. We do need to make sure we attend to rest and sleep. Short breaks and respite can be important. And so finding ways to do that, titrating the news down, and making sure you do identify at least something each day, a small moment that it may be, even if it's just a call to your partner or your children or whatever it may be, to make sure you have at least that one moment in each day for yourself and for your own needs, I think are important. And maybe the last thing I'll say is, many have in some form or another expressed the sentiment that we're not just fighting a virus right now, we're fighting fear. And that we as physicians can really either amp up that fear in the team and our own behaviors and interactions, or we can be the catalyst, the agent who brings a sense of compassion, support, caring, honor to our colleagues and our team in this unprecedented time. And I think if we can all reframe ourselves on making sure we take those moments for ourselves, and so that we center and then are able to bring that calm to our teams, I think that that is part of our charge, our role, our mission as physicians, to bring that to our team, our hospitals, our patients, and our societies in this unprecedented time.
That's just beautifully said, and we couldn't end on a better note. We want to thank you so much for your time.
Thanks so much. Great to visit with you.